Hi everyone, so for today, we're giving or demonstrating a bed bath on a patient. Okay? So we're doing a bed bath for the patient to feel better, for them to give them comfort, and for to clean or protect the patient against infection. Okay? Clean the dirt from the patient. Okay? Now, before we start doing the bed bath, we have to consider things before starting the procedure. First, be sure that the curtains are closed for the privacy of the patient and for her security. We have also to close the door and also we have to control for the temperature of the room. Okay? That are the things we have to consider before giving a bed bath for a patient, especially if the patient is bedridden. Okay? So before we start, always identify the patient by two identification. That will be your full name, first name, middle name, and last name, and then the other one is your date of birth, or if in the facility you're applying the medical record number, you have to check for the medical record number that is written also for the ID band of the patient for a patient's identification. Okay? Then, when we enter the room, be sure that before giving a bed bath, we should do hand hygiene. Okay? Never forget to do hand hygiene when performing any aseptic task or entering any patient's room. Okay? Then, before giving bed bath, we should also wear our PPE to protect ourselves from infection and also to prevent contamination, cross-contaminants for the patients that we bring. Okay? In wearing your PPE, make a seal for for us to prevent of losing the gown going in or going towards your elbow. Okay? First, go on the up, then on the back. Be sure that your back is still covering all the clothes you had. Then wear your mask. Then after wearing mask, consider I'm already wearing my mask. Then we will wear also another part of PPE for contact precaution will be our gloves. Okay? So now we are ready to give bed bath for the patient. And first, we have to identify the patient, or if she can talk, ask her what's the full name. Then, after patient identification, we will now give the patient's bath. Okay? First thing we should do is by putting the draping towel. Okay? This will be our draping towel. Then, by simply removing the linen here. Okay? Okay, let's remove this. Okay? Okay? Then, put the in the laundry bin. Okay? Then, after that, we will remove the clothes of the patient. If the patient is hemiparesis or hemiplegic or is suffering from stroke, we have to remove first from the normal side. Okay? For example, this is the normal side and that's the affected. So, as to remove from the normal side of the patient. Okay? Okay. Removed. Then, let's proceed to the other side. Go on the other side. Okay. And now we can remove our gown. Then again, you have to put it in the laundry bin. Okay? Now we can start giving bath for the patient. Okay? First thing, be sure that I already set up everything. Taken already the water. Check for the temperature by using the elbow. If it's comfortable warm for the patient or for the client. But if the patient can talk, you can ask her to dip his hand and check for the water temperature if it's comfortable warm for the patient. Okay? Then, now we will start by doing the paste. Okay? First thing you have to do is get a hand washcloth. Put a hand mitten technique. Okay? Then, dip into the warm water. We will start with the eyes. Okay? Eyes. Okay? From inner to outer. Okay? Opposite side. Then after that, we will proceed to squeeze the water out. Then we will proceed now for the forehead. Forehead to the cheek, going to the neck. Then opposite side, forehead to the cheek, going to the neck. Okay? Then, after doing that, we will now proceed to the chest of the patient. Okay? By simply putting the towel then removing the draping, the little gown. Okay, covering our this way, easier for you. Okay, then taking again your washcloth, another washcloth, making a hand mitten, another new washcloth, hand mitten, then water. Then rub to the chest, from the neck to the chest. Also the other side. If your patient is a female, be sure that you be careful of be aware that there are some folds for the folds of the skin folds of the patient under the breast. We should also clean that area because it can also it will also cause infection for the patient. Okay, so if the patient is bigger, we might need another towel for the abdomen. But since I have a smaller patient, I would use the same towel. And now I change the washcloth. Then after changing the washcloth, I have to put another method technique again. Then wash, soak it, then go with the abdomen. Okay, be careful also with the umbilical region. Okay, after that we will now proceed to always after using a washcloth, you have to change another washcloth. Okay, another washcloth for the arm. But this time, we're going to need for us to prevent the bed to get wet, we're going to need underpads. We're now cleaning for the arm. Let's put the arm. This position. Then get the towel. Make a hand mitten technique. Drop it, wet it, and already wash from, again, don't forget to from distal to proximal. Okay, distal to proximal. Also at the back side, distal to proximal. Okay, after cleaning the arm, now we will proceed to clean the hands. Okay, again water, then cleaning each finger. Be sure for also cleaning on the folds of the web of the finger. Okay, okay, front to back. Okay, then now for cleaning the armpit. By the way, after cleaning the arm, you should also put a towel and dry the water out. Okay? Same thing on this side. Okay? Now we will proceed with the arm. Okay? By flexing the arm on this position. Okay? For the axilla. Okay? Ask her to do this one, then water, then clean for the axilla. Okay, dry with the towel, then put the arm back. Okay, now we will proceed to the other side. Okay, we'll transfer the water. So So it's not going to be hard pressed. Okay. Let's clean for the opposite arm. Okay. Same thing we are doing. Removing this one. Okay. Keeping the arm inside. Prevent colds for the patient. If there's a new one like this, you can change for another arm. It's better to have a lot of underparts. Okay? Put it on here. Up to the shoulder again for the axilla. So, then for the arm until the hand. Then hand mitten technique. Then soap water from distal to proximal. Opposite side at the back. Okay. Then go. So for the hands, be careful of the web of the fingers. Okay. Then dry it out with the towel. Dry it out. Then let's proceed for the axilla. Okay, try again and clean the axilla. So dry it again for the excess water. Then bring back the hands down. Okay, again remove our underpads. That helps us to protect from getting getting the bed wet. Okay? Now, since I'm already on this position, I will start on this side for the lower extremity. Okay? In giving bath for the lower extremity now, we'll start by putting again with the underpads. Okay, a skirt and hip. Okay. Then I'm gonna had to change my washcloth. Okay, let me change my washcloth. Okay. And knit the towel again. Then consider water. Then from distal for the leg, lower leg, going to upper leg. Again, the back side, distal to upper leg. Okay? Then, I'll proceed with the toes. Okay? Be careful of the web of the toes also. The bottom. Clean thoroughly. Then, dry it out with another towel. Be sure that you have towel on your side for the lower extremity. Dry it out. Also for the feet. Okay? Now we will proceed to the another side of lower extremity. Again, be sure that you're changing your underpads. You have a lot of underpads for your patient. Okay? Put your underpads on the other side. Okay. Let me get my water. Okay. And my towel. Then, again, make a hand knitted technique new washcloth because it's for sure for the sole. One washcloth will be really already contaminated or will prevent infection. Okay, again, water, then distal to proximal on front, then distal to proximal on the bottom, then dry it out, so already dry. Now let's proceed to with the feet. Okay, front, digits, the toes, then at the back of the or sole of the foot. Okay, then dry it out. You have to dry it out. After drying it out, okay, put everything on the linen. Okay, then remove it. Okay, removing it, going to the, now we will proceed to the back of the patient. Okay, again, we have to discard this and take new one. Okay, we have to take new one. Take new one, guys. Take new one. Okay? Take for the new one. Considering now we're going to the back side, we should, if we're doing for the back, be sure to change the water and refill a new water because it's already too dirty from cleaning all the parts of the body. Okay? Consider that I already changed the water. Now, after changing the water, and we will now proceed to the back of the patient. Okay? And the buttocks of the patient. Okay? Now we will do side lying for the patient. Okay. Let me just remove my towel. Okay. Then discard. Okay. Sides. Put the sides of the patient on your side. Here, move your hands and turn the patient on this side, covering at the back. Again, it's better for you if you are in front, if you are alone, not to be on the back. Okay? For you to support the back of the patient. Okay? So putting another drape towel or underpads here. Then, we will now proceed to the back of the, we're taking your washcloth. Then, make a hand mitten. Okay? Especially if it's bedridden, hand mitten, put a water, should be near you. Then, from top to bottom, slide top to bottom, top to bottom, top to bottom, until to the buttocks. Okay? Then, dry it with the towel. You're drying it, putting some lotion will be good for the patient. So, put some moisturizer at the back of your patient. Okay? And removing it up and putting the patient lying down, back again. Okay? Okay? Discard these things. Okay? Now, we're done giving a bath for our patient. We should change her clothes with the new clothes by starting again with the affected side down. Okay? The last time you did was the affected side. To remove that, the first thing you will wear is for the affected side. Okay? Sides. Okay. Before proceeding this one, we should change your gloves. Okay? Because it's already clean, your patient is clean. So before wearing the clothes, be sure that you didn't forget to change your gloves. Okay? Opposite. Okay. Patient now is with the new clothes. Okay. Be sure that the patient gown is well kept before removing our draping towel. And return putting this on the laundry bin. Okay? Then changing a new one for the patient. Changing for the new linen. Okay. Then we can also comb the patient's hair before leaving her behind. And after that, you have to clean all what we used and discard our things on the trash bin. Okay? First, remove the gloves. Then, remove your gown. The buttocks. At the above. First here. Then, here. Away from you. Then, up. And then on the trash bin. Okay? After doing that on the trash bin, now we will do the hand hygiene. Okay? But, when removing the gloves, we should wear, when removing us, we do hand hygiene. Okay? After removing the gloves, we remove the gown, then hand hygiene. Okay? After doing that, remove the mask, then again, hand hygiene. After removing the mask. Then, that's the time you can leave your patient to fall asleep. Okay? So, that's for bed bath. Thank you.